When people have strokes, it can affect almost any function of the brain. Most of the language areas are in the left side of the brain. So if people have a stroke on the left side, then there's a pretty good chance that it may affect their language. The gold standard therapy, if you've had an aphasic stroke, is really to see a therapist, and they will treat all aspects of your language that have been affected. So most people with aphasia will have problems speaking, that's the most obvious thing, but they may also have trouble understanding what people are saying, trouble with their reading and trouble with their writing. And because time is limited, therapists will often focus on certain aspects that quite rightly that the patient wants to focus on, such as their speech production, and they perhaps won't have time to work on other things. And we've come up with a whole variety of apps which will target this, all with feedback. It's very important that in order to learn or relearn, that you get feedback on every single trial. And this is what a therapist would do, but the therapist, of course, doesn't have time to do that. So these apps are focused on individual language impairments, and so they're not broad in the sense that a therapist would treat a whole bunch of things. These apps just treat individual things. So if you want to get better at reading, you need a reading app. If you want to get better at understanding language, you need a comprehension app. And if you want to get better at speaking, you need a speaking app, and that's what iTalkBetter is. So this focuses on speech production. We show people pictures, and they have to name the picture, and we give them some prompts and support, and eventually the aim is so that they'll be able to access that word without having a prompt at all and be able to incorporate it into their normal language or speech. We showed that by practicing with the app, patients get better on the words that they practice but not on words they don't practice, and that's not a surprise. That's true for normal language learning. But what we also showed was that they get better at speaking in general. In other words, they produce more words per minute. So there does seem to be some knock-on effect into conversational speech. And we also did some brain imaging which showed that there were some use-related changes in the brain in various language areas, which I guess you would kind of expect. But it was nice to demonstrate that we can see that the brain changes as people use these apps.